UAB medical professionals met this week to share a COVID update as cases are on the rise again. One doctor explains why that may be happening and which variant is to blame. Let's take a look.
We are in an upswing, or what I would call another surge. And I think if you are talking to anybody, you know someone probably who has COVID right now or who has had COVID in the last couple of weeks. Seems like cases are coming at us thick and fast.
Dr. Jean Marazzo is UAB's Division Director of Infectious Diseases. She says the BA.5 subvariant of Omicron is becoming the dominant strain, being over 85% of COVID cases. She adds it's one of the most infectious variants we've seen so far, and it's having an effect on the current COVID vaccines.
The evolving variants continue to adapt to the vaccines and the protection that the vaccines have been so good at giving us. The vaccines that are currently available are still active against the current variant, the BA.5, the BA.4 variants of Omicron, but they're not protecting against infection or acquisition of the virus as well as they did previous strains.
Right now, she urges people to be thoughtful in crowded settings.
There's no question you can prevent it with very good masks, N95s, KN95s, but the diligence, the persistence, and the consistency of mask wearing, and probably also being thoughtful about how you are in a close space, what's the ventilation like, all those things have come back into play in sort of considering the risk for BA.5.
Dr. Marazzo says we'll likely hear from the CDC soon about what to expect this fall, with a potential recommendation for a vaccine that will involve a prototype strain with the basic coronavirus and a component specific to BA.4 and BA.5.